So what Mr. Marion has over here, he has a little bit of arthritis, mostly medial compartment. So if I do this really hard, he'll probably say, ouch. Ouch, right?
Yeah.
So what I do is I find the joint line. Okay, I'm gonna make a little mark on it here. Now this is not Steve's first rodeo, by the way. He's actually had PRP before. We're doing platelet-rich plasma today, and we're doing high concentration platelets. So we're using the M-site system here, which is a double spin type system. In comparison to some of the more simpler systems which don't concentrate platelets very well, and those are the single spin systems. This is a double spin system, and it's all done using these closed sterile tubes, so then they're very safe, and it keeps your plasma away from the atmosphere until basically it's used, so it's actually really safe. So he's actually had this done a couple times already. So Steve, can you tell me how you did the last time we did this?
Well, I did fantastic, as it seems to get better and better each time. We started with actually stem cell, and you discouraged stem cell from the cost perspective and said, let's try PRP. And I found it's helped me continue to ride my dirt bike, ski, extreme snow, and live the lifestyle that I want to without having to see a knee replacement doctor. Try to prolong this as long as I possibly can.
So that's the impressive thing about Steve. I mean, he's like typical patient who wants to stay as active as possible and not have a joint replacement. I'm gonna numb you up over here, okay, Steve? What I'm doing right now is now I'm injecting a little bit into the skin and tissue and the joint right here. I can tell I'm in, and then I'm gonna be injecting it. But that's what's nice about, just to change topics, is that he's been able to stay active. So now I'm gonna focus on here at this point. I left the needle right there for a second. What I'm gonna do is I'm gonna take the platelet-rich plasma. I'm gonna put it on a 22 gauge needle now, okay? We're gonna put it on the needle, boom, boom, boom. Okay, and then I take this needle out. I keep my trajectory in mind. I know it's gonna be right here, a little poke, okay, Steve? Okay, you're doing great. And then what I do is I use my ultrasound to make sure that we're in. So this is a sonocyte musculoskeletal ultrasound. So what I do is I got some gel right there, and if we look at the ultrasound monitor here, what I'm looking for is the needle to make sure that we are in the space. And there, if you look over there on the monitor, you can see the needle on the right side. Look at the far right. You see the needle moving around? Okay, so now I'm gonna sneak it into the joint. Boom. You okay, Steve?
Yep.
Good. I'm actually in the joint, I can tell. And I'm gonna put, you okay? You feel that? You felt it? Okay. So what I'm gonna do, since he feels it, what I'm gonna do is I'm gonna move it a little bit, because it might be actually near some soft tissue. Yeah, that's basically what that tells me. Thank you, Steve. So what I'm gonna do is there's my needle again. Boom. How about there?
Good.
Oh yeah, see, so now I'm making sure I'm keeping my spot there. We're gonna put about 5 cc's over here. You still good?
Yeah.
Beautiful. Okay, so that's in the joint. Okay, so as soon as he stands up, it's going to rain down towards the joint surface. And now I'm gonna focus on this capsule. This is where we really need to have the ultrasound, because I need to make sure I get it in the right spot. And before I do this, I'm actually gonna cap this back up. I'm gonna inject a little bit more local because I know it's a little bit of a tender spot, okay? So I go back over here. You okay, Steve, so far?
Yep.
Okay, good. I'm numbing you up a little bit more, just to scan. I know it burns a little bit. I make sure I'm in line with the joint. I go a little bit deeper. Make sure we're okay, a little deeper. Okay, numb it up. And actually what I'm gonna do is a little trick that I learned. It's a little trick I learned in Nam. Not Vietnam. Nam, the convention center, the convention. I'm just kidding, just trying to be funny here. So now I'm actually on the capsule, and what I'm gonna do is I'm gonna take a little bit of the gel and I go right here, okay? So now we look over there on the screen, see that? And I'm actually gonna make sure, I'm gonna move my needle a little bit here because I wanna be a little lower. Little poke, Steve. Sorry about that. It's gonna come up. Okay, it's a little bit high. You can see I'm a little bit high right there. Okay, I'm still gonna put it in right there. But actually I want to be a little bit more distal. There. Okay. You see it filling up right there? Okay. And I'm still not in the best spot. One more little poke, sorry.
Can't feel it.
Good. There it is, right there. You see I'm right at the joint. Okay, I'm actually right at the joint. And right there, there's a little white spot that just popped up. You can see a little white spot. Okay, I'm gonna go a little bit deeper down to get, boom. Okay, you can see?
Yep.
Good. And even a little bit lower. Okay, now there's the money spot right there. Okay, money spot's right there. You can see this little white flash. You okay, Dr. Hassan? You're not gonna just fail on this, are you? I know you're not used to seeing guided PRP injections. I know you're used to doing robotic knee replacements, which Dr. Hassan does in an exceptional way. Okay, good. This is the money right here. All right, so you can turn back over here against. So then I just want to make sure that we got a nice. I can feel the capsule. This seems to help people a lot. This part of the injection is actually very important right here, because this is where people hurt. And don't ask me why. It helps relieve the pain here. It just does. I can't explain everything with this stuff. Okay, so medial capsule right where he was hurting, okay? Okay, so that was a platelet-rich plasma for the treatment of osteoarthritis on both knees in a highly active young person. How old are you, Steve, again?
59.
59 stud, motocross guy, skier, black diamonds. He's got moderate arthritis of both of his knees, and this is what's been keeping him going. He does it about twice a year.
About twice a year, yeah.
About twice a year. Okay, just wanted to show everybody how I do the injections. This is Dr. Steve Moore at Restore Orthopedics and Spine Center with Dr. Hassan and our very kind patient here, Steve. Thank you so much.